Welcome to today's episode where we deep dive into common yet overlooked habits that could be worsening your arthritis. Did you know that some of the habits we discuss in this video might increase arthritis symptoms as much as 50%? Arthritis is a disease that affects millions worldwide, manifesting in various forms such as joint pain, stiffness, and decreased mobility. Today, we'll uncover how everyday lifestyle choices can significantly impact these symptoms. The extent to which these habits can affect arthritis may surprise you. Small daily actions or inactions can either protect your joint health or provoke further inflammation that leads to increased pain and further joint degradation. By understanding and modifying these habits, you can reduce your symptoms significantly, enhance your mobility, and improve your quality of life. This episode aims to highlight these critical yet manageable lifestyle factors, offering practical advice for taking control of your arthritis management. Be sure to stay until the end of the video where we uncover the top habit, which might just be worsening your arthritis. Additionally, if you find this type of content helpful to you, please like this episode and subscribe to our channel for more useful health tips and guides. The first item on our list might surprise you. It's carrying a heavy backpack. It's generally recommended that the weight of a backpack should not exceed 10–15% of your body weight. For example, for someone who weighs 150 pounds, the backpack should not be heavier than 22.5 pounds. This guideline helps prevent excessive strain on the joints. Carrying a heavy backpack can significantly strain your joints, particularly if you suffer from arthritis. The excess weight of a heavy backpack increases the load on your joints, especially the spine, hips, and knees, which can exacerbate pain and inflammation associated with arthritis. This kind of stress can also lead to poor posture and misalignment, further aggravating joint discomfort and potentially causing long-term damage. It is crucial to limit the weight of your backpack and ensure it is properly fitted and worn correctly. Ideally with padded straps and a belt to distribute the weight more evenly across your body. Excessive texting can lead to repetitive strain injuries, particularly in the hands and wrists, which is a significant concern for those with arthritis. Constant typing on a small mobile device requires repetitive thumb and finger movements that can increase stress on the small joints of the hand. This repetitive activity can exacerbate existing arthritis symptoms, leading to increased pain, stiffness, and potentially long-term joint damage. To mitigate these issues, you should limit continuous texting sessions, use voice-to-text features when possible, and perform hand-stretching exercises to relieve tension. Implementing regular breaks during texting sessions can also help manage and prevent the worsening of symptoms. Even better, consider a phone call next time instead of personality-lacking texting. While it might seem counterintuitive, staying active is crucial for managing arthritis. Exercise can be challenging when you're experiencing pain. However, it helps to maintain joint function, decrease stiffness, and strengthen the muscles around the joints, providing better support and reducing overall pain. While vigorous activities might be too challenging, low-impact exercises like swimming, cycling, or yoga can significantly benefit without stressing your joints. Our best advice is to find an exercise that you enjoy and can perform regularly without discomfort. This one might be a bit more obvious, but the food you eat may have a drastic effect on your arthritis symptoms. For example, diets high in processed foods, sugars, and saturated fats can trigger inflammatory responses in the body, exacerbating arthritis symptoms. These foods can not only increase inflammation, but also contribute to weight gain, which puts additional pressure on your joints, especially the knees and hips, the ones that bear most of your weight. To combat inflammation, incorporate anti-inflammatory foods into your diet, such as fatty fish, turmeric, ginger, and plenty of fresh fruits and vegetables. These foods can help reduce inflammation and provide your body with the nutrients needed for better joint health. While exercise is beneficial, overdoing it can be just as harmful as being inactive. High-impact or overly strenuous activities can cause joint damage and exacerbate pain, leading to longer recovery times. It's important to balance your activities with adequate rest and recovery, especially after intense exercise. Listen to your body and learn to distinguish between the normal discomfort associated with exercise and the pain that signals harm to your joints. Overexertion in exercise can manifest itself through several key indicators. For example, High-impact activities like running or jumping may place excessive stress on joints and can lead to inflammation and pain. Additionally, prolonged exercise sessions or intense workouts without adequate rest days can lead to overuse injuries, as joints require time to recover from stress. It's crucial to monitor the type of discomfort during exercise. While mild discomfort might be typical, sharp, acute, or persistently increasing pain is a clear signal of overexertion. Furthermore, exercising to the point of extreme fatigue can compromise form and technique, increasing the risk of injury and indicating that the body's limits are being overstressed. Extended recovery times after workouts also suggest that the exercise intensity or duration may have been too much, highlighting the need for a balanced approach to physical activity. Ignoring arthritis pain can lead to more significant joint damage and more severe pain. Listening to your body and addressing symptoms early before they worsen is crucial. Certain pain types can suggest serious conditions or the need for adjustments in treatment or lifestyle. Here are some common pain signals as they relate to arthritis that deserve careful consideration. Persistent pain, pain that doesn't go away after a few days or continues to recur over time, should not be overlooked. Chronic pain can be a sign of underlying issues, such as joint degradation, inflammation, or even non-musculoskeletal diseases. Severe pain, intense pain that comes on suddenly or is severely debilitating, should be treated as a red flag. This type of pain can indicate serious injuries, such as fractures or ruptures, and requires immediate medical attention. Pain accompanied by swelling. Swelling or inflammation in the area where the pain is felt often suggests an acute injury or an exacerbation of a chronic condition like arthritis. Swelling can also indicate infection, especially if accompanied by redness and warmth. Pain with neurological symptoms. If pain is accompanied by numbness, tingling, weakness, or loss of function in a limb, these could be signs of nerve damage or compression. Such symptoms require prompt medical investigation to prevent long-term damage. Alcohol can have both positive and negative effects on arthritis. While moderate alcohol consumption may have some health benefits, such as potentially reducing the risk of developing rheumatoid arthritis and providing some cardiovascular benefits, excessive drinking can be detrimental to your arthritis. Drinking too much alcohol can increase systemic inflammation, interfere with the effectiveness of arthritis medications, and contribute to weight gain, which can put additional stress on joints. For individuals with arthritis, certain alcoholic beverages may exacerbate symptoms due to their specific properties. Beer, for instance, contains gluten and purines, which are metabolized into uric acid, potentially aggravating gout, a type of arthritis characterized by painful joint inflammation. Sugary cocktails, laden with high sugar content, can lead to increased body inflammation, worsening arthritis symptoms such as joint pain and swelling. High-proof liquors, due to their strong alcohol content, can lead to rapid intoxication and dehydration, further stiffening joints and intensifying discomfort. Each of these drinks impacts arthritis differently, and moderation is crucial to manage their effects on arthritis symptoms. If you choose to drink, it's crucial to do so in moderation, which typically means up to 1 drink per day for women and up to 2 drinks per day for men. Always discuss your alcohol consumption with your healthcare provider, especially if you are taking medications for arthritis. Alcohol can interact negatively with common arthritis medications like methotrexate and nonsteroidal anti-inflammatory drugs, NSAIDs, increasing the risk of liver damage and gastrointestinal bleeding. Moderation and a clear understanding of your health status are key when considering alcohol consumption as it relates to arthritis management. Sleep plays a vital role in managing arthritis, as it is essential for both physical and mental recovery. When individuals with arthritis do not get enough quality sleep, they may experience increased inflammation and a heightened sensitivity to pain, which can exacerbate their arthritis symptoms. Poor sleep can disrupt the body's natural healing processes, negatively affecting how well the body can manage and respond to pain and inflammation. The extent to which poor sleep can exacerbate arthritis symptoms can vary widely among individuals, but generally it can significantly impact the severity and perception of symptoms. Inadequate or disrupted sleep can lead to increased inflammation. Lack of sleep has been shown to increase the production of inflammatory cytokines in the body. These inflammatory markers can exacerbate the inflammation already present in the joints due to arthritis, leading to increased pain and stiffness. Heightened pain sensitivity. Sleep deprivation can lower the threshold for pain, making the body more sensitive to any discomfort. This means that arthritis pain can feel more intense when you haven't slept well. Worsened physical function. Poor sleep can affect physical function, making it more difficult to manage daily activities. Fatigue can reduce motivation for exercise and activity, which are crucial for managing arthritis symptoms. To improve sleep quality and manage arthritis more effectively, it is important to establish a regular sleep routine, create a comfortable sleeping environment, and avoid stimulants like caffeine close to bedtime. For those who consistently struggle with getting good sleep, it may be beneficial to consult a sleep specialist who can help address and resolve underlying sleep issues, thereby improving overall symptom management for arthritis. Chronic stress triggers the release of stress hormones, which can increase inflammation and worsen arthritis symptoms. Chronic stress can exacerbate arthritis symptoms through several interconnected pathways. Increased inflammation. As mentioned earlier, chronic stress leads to the prolonged release of stress hormones such as cortisol and adrenaline. These hormones, particularly when continuously elevated, can contribute to an inflammatory state in the body. For individuals with arthritis, where inflammation is a key factor in symptom severity, this can lead to increased joint pain, swelling, and stiffness. Cortisol resistance. In normal situations, cortisol acts to suppress inflammation and immune responses. However, with chronic stress, body tissues can become less sensitive to cortisol, a condition known as cortisol resistance. This means that despite high levels of cortisol, inflammatory processes do not get adequately suppressed, leading to heightened inflammatory responses that can worsen arthritis symptoms. Managing stress through relaxation techniques such as deep breathing, meditation, or yoga can help reduce this inflammatory response. Regular practice of these techniques can make a significant difference in your overall well-being and decrease the severity of arthritis symptoms. Excess body weight puts additional stress on weight-bearing joints, such as the hips, knees, and spine, which can worsen arthritis pain. Managing your weight through a balanced diet and regular exercise can significantly reduce this stress and improve your symptoms. Consult with a nutritionist to create a diet plan that supports both your weight management goals and your joint health. Excess body weight, often measured in terms of body mass index, BMI, refers to having a BMI that is above the normal range for healthy weight. For someone considered to have excess body weight in the context of impacting joint health and exacerbating arthritis symptoms, they would typically fall into the overweight or obesity categories, which would mean having a BMI greater than 25. The degree to which excess weight impacts joint health can vary depending on how much overweight a person is and for how long they have been carrying the extra weight. Proper hydration is crucial for maintaining joint health, particularly for individuals with arthritis. Cartilage, which covers the ends of bones and joints, consists of about 65–80% water. Maintaining adequate hydration is essential for preserving the water content in cartilage, which is critical for its function as a shock absorber and for reducing friction during joint movement. Additionally, adequate water intake supports the volume and viscosity of synovial fluid, which is vital for lubricating joints and minimizing wear and tear. Water also plays a key role in the transport of nutrients to joint cells and in the removal of waste products, processes that are essential for preventing the degeneration of joint tissues and for reducing the buildup of waste products that can exacerbate joint inflammation. Although the specific percentage impact of hydration on reducing arthritis symptoms is not well quantified in research, maintaining good hydration is widely recommended. This includes drinking 8–10 glasses of water daily with adjustments for factors like activity level and climate to support overall joint health and potentially alleviate arthritis symptoms. Wearing improper footwear can severely worsen arthritis symptoms, especially in the feet, knees, and hips. Shoes that lack proper support or are ill-fitting can alter the alignment of your joints, leading to increased pain and strain. For those with arthritis, it is essential to choose footwear with adequate cushioning, arch support, and flexibility to reduce the impact on your joints during movement. Orthotic inserts can also be helpful to provide additional support where needed. Investing in the right shoes can make a significant difference in managing arthritis pain and enhancing mobility. The last and final item on our list of habits bad for arthritis is smoking. Smoking not only affects your lungs but also has a profound impact on your joints. It can exacerbate inflammation and slow the healing process of the joint tissues. Quitting smoking can significantly reduce these risks and improve your overall health. Numerous studies have confirmed smoking has a detrimental effect on joint health, particularly in those with rheumatoid arthritis, RA, and osteoarthritis. It has been said that smoking can increase arthritis symptoms as much as 50%. Smoking is a well-established risk factor for developing RA, a chronic inflammatory type of arthritis. Smokers with RA generally have more severe symptoms than non-smokers. Studies have found that smoking not only increases the risk of developing RA, but can also influence the disease's severity and response to treatment. For instance, smokers are less likely to achieve remission and more likely to have progressive joint damage. While the link between smoking and osteoarthritis is less direct than with RA, smoking is associated with broader systemic inflammation and poorer overall health, which can negatively impact joint health. Smokers may experience a more rapid progression of joint degeneration, particularly in the spine and knees. Additionally, smoking can impair the body's healing processes, affecting the recovery from joint surgeries like total knee or hip replacements. Smokers often face longer recovery times and a higher risk of complications following surgery. In terms of quantifying the impact, some studies suggest that smokers with RA have a notably higher rate of joint damage compared to non-smokers, and smoking cessation can lead to a measurable improvement in symptoms and disease outcomes. For example, quitting smoking has been associated with improved treatment responses and reduced disease activity in RA patients. Quitting smoking is strongly recommended for anyone, but especially for those with arthritis, as it can significantly reduce inflammation, improve response to arthritis medications, and enhance overall joint health and healing capacity. Many resources are available to assist with quitting, including support groups, medications, and behavioral therapy. Taking the step to quit can be challenging, but the benefits for your joint health are worth it. We've covered the top 10 habits that might be making your arthritis worse. Each of these areas offers an opportunity for improvement. Small, consistent changes in your lifestyle can lead to significant improvements in your arthritis symptoms. Remember to consult your healthcare provider before making any major changes, especially concerning your diet, exercise routine, and medication management. Taking proactive steps in modifying these habits can significantly enhance your quality of life. Now, if you found this information helpful and want to learn more about managing your health, don't forget to like this video and subscribe to our channel. Your support helps us provide more useful content and keep you updated with the latest in health management. Click the bell icon so you never miss an update from us. Start making positive changes today and join our community for regular health tips and advice.